So I'm taking you into a couple tests to see if your hip is involved. Okay. So if I just lift up your hip, naturally your knee wants to go out. So you don't have good, clean flexion pattern, right? You kind of get stuck.
Right.
Okay. So you don't have efficient range of motion.
Okay.
I try to internally rotate you. You know, should we get about 15, 20 degrees at least? You don't have any. I can't internally rotate your hip. Your other side I can, about 20 degrees, okay? Checking external rotation. I'm going to cross your leg. This is Faber's test. So we're kind of checking if the hip can externally rotate and then testing the spine, the SI. You're able to get into the position, but your knee is like 10, 15 inches from the mat. You're not able to drop down. So we know there's a restriction there. And the range of motion also can be a tissue restriction. You know, you're limited by the pain of the adductor, right? And then if I take you up into FAI, testing to see if you're getting any hip impingement, I can't quite get you into it because right away it hurts. Right? Yeah. So we call that a positive test. We know something's going on inside your hip.
Okay. And so
Likely, I mean,
reducing the inflammation through icing and wrapping, and then would they do a epidural in there or some sort of cortisone shot? Or?
Yeah, I've had people get cortisones. I haven't seen them do an epidural in the hip, but cortisone like to calm the inflammation down. Likely is honestly if you see like an ortho for a hip stuff, they're going to probably image the hip to see what's going on inside the ball and socket.
Right.
And if it's just that they're like, hey, you know what, your hip is inflamed, they'll probably, you know, then we know, okay, cool, great, it's just that. Or they might see something going on in there and they might tell you what the possibility for treatment is. But it's interesting because you got it right after your surgery and you've had it for a long time. So again, we talked about this, but it's hard to blame it on a strain because strains don't usually last that long.
Right.
And you rested it and it never went away, you know? So, and now I'm having you do some stuff and we flared the hip up a little.
Right.
You know?
Okay. Well, I'll have to look back because they did some x-rays prior to the my back surgery, and they also, you know, x-rayed the hip as well. So I have to go back and look at those again.
Yeah. So I think what I'm going to do is I'm going to try to stretch your hip again because that'll help with the ball and socket movement. It'll help bring good fluid inside there.
Okay.
See if we can give you some relief. We'll ice it again. We'll just try to loosen it up.
Okay. Sounds good.